So how we're going to do it is we're going to hear from our two speakers, and then we're going to have plenty of time for a kind of panel Q&A. Please pop your questions in the Q&A as the speakers are talking, and I'll pick them up later. And if nothing comes through, I've got so many questions for them, so I don't think we'll have a trouble filling the time. But I'd first like to invite Shuo to talk to her paper on unequal effects of climate change and pre-existing inequalities on the mental health of global population. I'll stop sharing my screen and let you go, Shuo.
Great. Thank you very much for inviting me to speak, and also for that amazing introduction, Kat. I think you've summarised it really well in terms of the broad scope of the mental health impacts, but also what little we do know in comparison to other areas. So I'm just going to share my slides. And I guess whilst I do that, I should also say that I am at work, which is that's why I'm in scrubs, and I've let people know that I'm busy, but there's a slight chance we might get interrupted. Great. So I thought I'd start with this this image of myself about 5 years ago, because I guess I am a doctor, first and foremost, and I first became involved and became aware of the climate and health impacts at medical school. So I remember the 2008 Lancet Commission coming out, and I guess so before I was a psychiatrist, I felt that as a doctor, we had a duty to advocate for our patients and advocate for factors that will be causing illness and disease. And I guess that thread has informed my thinking, and I guess now is informing in terms of the way that I guess see the evidence around climate change, and I guess a lot of my motivations in terms of thinking about the mental health impact have come from an awareness that over the last 10 years there has been a lack of mental health information, which, as Kate mentioned, was one of the reasons why I was involved as well with colleagues at UCL in a meta-analysis and review of air pollution and mental health impacts that was led by Dr. Isabel Braithwaite. And actually the reception of that was really surprising to us, because it attracted kind of global interest, I guess, further highlighting kind of a lack of maybe evidence, but also, I guess, an interest. So there's other news providers, obviously, media interest in climate change impacts and mental health, from both direct impacts like flooding and I guess indirect impacts, thinking about the psychological impact that it's going to have on the mental health of children and adults. And as Kate mentioned, I've been involved in the College Planetary Health and Sustainability Committee, and it's been really great to work with such an amazing group of people, and it's been really great for college to be very responsive, and we've produced a positions statement that is a good summary of some of the evidence around multiple domains, and this is freely available on the college website as well. So now coming to the paper itself, this was so the paper, so like I said, I kind of mainly wanted to have a reflective piece on linking some of the mental health literature that we have around cities and the inequalities in terms of mental health within cities and other populations, and the drivers of mental that contribute to mental health disorders, and to kind of think about what we know about the literature on climate change in general. So we know that in terms of direct mechanisms, there's increased exposure for people to factors like air pollution, to heat, and to flooding. And there's evidence from Holland and England that people in the most deprived and most ethnically diverse neighbourhoods are exposed to the highest levels of air pollution. But there's also broader factors in terms of just an increased vulnerability in general in these communities in terms of withstanding any of the impacts of climate change, and that relates to ongoing cycles of discrimination, exclusion, poverty, dispossession, and malnutrition. And some of this evidence has been emerging in terms of how the global response to COVID has impacted these communities. In terms of indirect, and I guess thinking about things on a more systemic level, I think this quote is quite powerful from Celie Huggins, that we can only really understand the harm brought by climate change and weather impacts by really directly connecting it to a broader social and political system, of which structural racism is a central part. And we know from previous work and previous studies on impacts of natural disasters that there are unequal impacts. For example, following Hurricane Katrina, Black and ethnic minority communities had much higher levels of PTSD and also stress from that event. And there's also an argument that actually people with severe mental illness are at greatest risk because of their pre-existing vulnerabilities. And that could be as a direct consequence of their illness or medications like lithium or antipsychotic medications, but also the common risk factors to mental health disorders like social exclusion, stigma, discrimination, and unequal distribution of resources. And so then just thinking about what does that mean for us day to day. So there's quite, I guess, because people live, most of the global population live in cities, that is an area in which people have increased exposure to all of these factors. But also there's inequalities in terms of access to interventions, and there's evidence in terms of the access to green spaces for different populations is unequally distributed. But I guess importantly, even though this is an emerging area of research, there is a significant lack of research in lower middle income countries. And in the process of thinking about all of these issues, me and my co-authors reflected that actually this is a complex problem on multiple levels. And I guess having the sort of rigorous and causal mechanisms is difficult in terms of, I guess, truly saying that we have X and Y solutions, and these impacts are caused by, these outcomes are caused by these impacts, and that we will need a different approach in terms of thinking about these issues. So that's maybe moving away from or combining quantitative approaches which have tended to focus on risk factors that might be more direct, to thinking about how things relate in a whole system. So we are advocating in our paper that we need to think about I guess, structural understanding, a systemic understanding that looks at how the intersections between pre-existing inequalities and for mental health and other social factors like globalization and how people live in communities and are affected by a whole range of different stresses related to the social world can in total affect their mental health. And we also really wanted to advocate for action for mental health professionals, but for all health professionals. And we wanted to develop a framework that would be useful in bringing people together in a collaborative way to address a complex problem. So we used a approach called CHARM, which was first introduced by our colleagues in Australia, New Zealand, and it calls for us to collaborate with disadvantaged communities so that their voices and priorities are better heard, so that they can influence policy decisions, and that and to recognise that we need to build on multidisciplinary work across different specialties and different networks in addressing the key issues around climate and mental health challenges. We also need to kind of advocate for our patients and communities in terms of their mental health and well-being, and to think about ways to strengthen local community resilience so that together we can tackle global injustice, and that we do need to advocate for to policymakers for extra funding and to both understand where to intervene and to offer broader systemic changes as well. We also have a role to research and educate and to share our knowledge with others to both improve our understanding of the mental health inequalities and the climate vulnerabilities, and to kind of build towards resilient communities. We need to work out how to build evidence around the right interventions and to be able to scale those up in both locally and globally. And we need to advocate for a better share of the funding and a better share of the funding, both for research and for kind of implementing these findings. And finally, I guess we have a role to kind of think about mental health in its broader context and to try and mitigate some of the effects. So treating mental illness earlier across the life course and focusing on prevention would be really, really important, as well as strengthening mental services in general and improving the links between mental health services and local communities. And I guess in the UK, acknowledging that there's probably still disparities to access to mental health services and access to quality care in the UK, and that would extend across Scotland, Wales and Northern Ireland. And we have a duty to kind of reduce the carbon impacts of the service delivery itself and of the NHS. So I thought I'd end with this image, which has remained with me through the years, is that, what if this is all a big hoax and we create a better world for nothing? Because I think some of the things that we can do together all make sense, and even if there isn't a crisis, it's still better that we work on prevention to prevent people from becoming more ill. We build better from becoming more ill. we tackle some of the social inequalities, and we have better collaborative care with our patients in their local communities. So thank you very much for listening, and I'll be happy to take any questions as part of the discussion.
Thank you so much, Shuo. It's a really, really important area to think about, the kind of intersecting factors here and the kind of global aspect as well, particularly important for psychiatrists. And I guess one of the things that we're often sort of criticized about as psychiatrists is that we're not sort of understanding the systemic issues, that we kind of see pathology within individuals and that we don't do enough on prevention or understanding the kind of systemic factors. So really important. I have lots of questions for you, which I'll ask later, but right now I'll hand over to Anushka to talk about how eco-anxiety isn't an illness, which I think is a fantastic start to the talk.